Hello everyone, Pepper Hernandez from drpepperhernandez.com, coming to you to talk with you a little bit about the endocannabinoid system, specifically the cannabinoids, this cannabinoid CBC, talking about what it is, what it does in the body, what strains we can find it in. Now, a lot of this information is coming from the Cannabis Holistic Institute. If you're interested, go over there, apply as a student. This is just a teeny, tiny, like a granule of salt compared to the information, the overwhelming information that we're always pumping through that particular institute. So let's talk about CBC. CBC is a cannabinoid. We are going to find that right along with CBD, CBG, THC. If you're watching some of the other videos, we cover all of them. I'm just make them quick little 5-minute snippets, but there are hours devoted to one particular cannabinoid. This CBC brings pain relief, inflammation reduction, bone growth promotion, and cancer cell growth inhibitor. Now, this is proven scientifically through research and studies from around the world. So these are definitely sound bits of information, okay? The strains, the two that I'm going to talk about today, if you can see there's a little bit of a glare, but blue cookies, that's obviously a cross. It is an indica-dominant strain though. And when found, like here up in the northern California, Emerald Triangle area, we're going to hold these obviously accountable to organic, sustainable farms, sun-grown, or, climate-controlled indoors, like super kind, really great. This is a cross. Now, this is the thing. Every single cannabis, if it's done whole flower, which again, I'm going to keep pumping that one out there, whole flower, with the whole entire entourage effect, what you're going to find is in strains, you're going to find CBC that also has CBD, THC, and so on and so on. So this is where it gets a little finite, okay, is you need to figure out if you like THC. And if you like THC, do you want an indica or you want a sativa strain-ish, right? Because the terpene fingerprint is going to give you a little more of the high or a little more of the mellow, right? You need to figure out that you want. Your delivery system, the way you're going to get into the body. Is this going to be a topical for inflammation or pain relief? Do you just want a topical? Topical probably isn't going to shift too much, but you don't want your muscles to be overactive, so you don't want to lean towards the sativa side or that, inspiring, exhilarating feeling of euphoria. You may want to be more like the relaxant lavender or those terpenes, which we'll talk about terpenes very soon too. But the blue cookies being an indica dominant, it has 0.3% CBC. Now that's one of the higher ones, right, that has CBC. But you're also going to look across the board at that particular strain. Now, not all strains are created equal, which also means that you need to have your farmers need to be organic. You need to know your farmers and look at your terpene fingerprint. Look at the studies. Look at the testing that's been done to find out exactly how much percentage of what cannabinoid is going on in that plant. If you're going to smoke it, if you're making a salve out of it, if you're tincturing it up, if you're concentrating it, you need to know all of this. It is definitely coming down to a fine science, and it's going across the board. Everything's just kind of being hybrided out, or people are just growing whatever, and that's fine too. But if you're really looking at this from a serious perspective, that's me, fine tuning. You're looking at it from a super geeky perspective.